Okay, our next group of points are San Huang, or 3 yellows, 8812, 8813, and 8814. These points are particularly good for conditions of the liver, cholecystitis of the gallbladder, and elevated liver enzymes, you name it, up and down the line, all types of liver conditions. So something to remember here on the inner thigh, in the liver valley, these points are 1.5 to 2.5 sun deep, so relatively deep points and relatively proximal as well, as they're spread out 3 sun on either side of the main point, so they cover a pretty large area. So midway on the medial thigh in the liver valley, let's see, that is between the abductor longus and the sartorius and the medial muscle of the femur. So again, these are wonderful for cholecystitis, increased enzymes, blurred vision, and eye pain. Interestingly enough, they're also intervention is the common hepatic nerve and the cardiac nerve on the deeper level. So the cardiac nerve is deeper actually, in the common hepatic nerve is not as deep. So there's our indication for the 1.5 sun to the 2.5 sun of depth. Interestingly enough, also good for leukemia, as you know, a blood disease. So once again, the liver is responsible for that condition. So we're going to begin with this particular treatment with point location midway in the liver valley. And typically I use a 40 millimeter needle midway, again perpendicular to the skin. So 3 sun, 4 fingers proximal. Check your line. Clearly see here, straight line. These are 40 millimeter needles. They can certainly be 50s, depending on the condition, for depth. And often these will be retained for 45 to 50 minutes. And some great stories with these particular points, which we'll talk about later. But again, this is San Huang, 3 yellows, 8812, 13, and 14. So once again, finding the liver valley, center of the thigh, 4 fingers distal, 4 fingers proximal, and this one is, they're all, of course, once again, they're perpendicular to the skin. And to repeat some of the conditions: cirrhosis, hepatitis, cholecystitis, increased enzymes, blurred vision, eye pain, leukemia, of course, of the most common. So considering the hepatic nerve, this one's more likely to be around 1.5, 1.75 to 2.2 to 2.5 sun deep. We're treating more issues of the cardiac nerve. So certainly we would be considering that one for leukemia.